I did the psychological evaluation of Jenny Curran from Forrest Gump. And in her psychological intake assessment, the patient, Jenny Curran, is a 30-year-old female who states she currently resides in Greenville, Alabama, and formerly resided in Berkeley, California. I interviewed Jenny before her passing a few years later. Her patient's family history states that she has lived in the United States her whole childhood with her biological father until her father was incarcerated after years of physical and sexual abuse of his daughters. The patient then claimed to move in along with her two sisters into their grandmother's home. The patient, Jenny Curran, states she then moved into college residence where she later dropped out and became homeless for 10 years. Patient claims to have a healthy relation with her grandma and sisters, but hasn't seen her dad since his imprisonment. The patient's school or work, she states, was previously working as a model in Playboy magazine and after her career as a prostitute and stripper in Washington, D.C. The patient states that she is now currently working as a waitress. The patient reports that all of her previous relationships have ended poorly. Patients seem to have trouble developing healthy relationships. The patient mentioned Forrest Gump and described their relationship as constant. However, Forrest is not currently in her life. Some medical issues is that the patient stated that she has recently been diagnosed with hepatitis C. Patient reports birthing one child, and patient has hallucinated flying as a bird and has attempted to fly. Her GAF score is 50. Some symptoms of Jenny is she has flashbacks that are recurrent and unwanted of her distressing memories of her traumatic relationships with both her father and past relationships with boyfriends. She's also had some emotional disconnect with Forrest and some of her other relationships. She's having this constant feeling of worthlessness. She often feels guilt, fixating on past failures or of her self-blame. She has excessive worry, very persistent, and worry over control of obstacles that she can't really control. She's a frequent crier and feels sadness and hopelessness over tremendous amounts of time, and she sees delusions and periods of stress-related paranoia and loss of contact with reality. This is when she believes she'll turn into a bird and fly away in any stressful situation. So my first diagnosis for Jenny is she is a trauma patient who has post-traumatic stress disorder because of her molestation as a child from her father and the physical abuse that her and her sisters went with. My second diagnosis is a personality diagnosis, which I gave her borderline personality disorder, which Jenny's whole character in Forrest Gump really is borderline personality because she's always not sure about herself and she turns to sex and substance abuse. Of course, her borderline personality disorder is not only to blame for her substance abuse. The third diagnosis I gave her was a major depressive disorder because she has felt so sad over several years of her life. She was homeless for about 10 years, and that's when Forrest was at war. And she's felt extreme depression, mad insomnia. She felt worthless for a few years, and she's had diminished most ability to concentrate, and she's had recurrent thoughts on death. That's when she tries to fly like a bird. So for my fourth diagnosis, I gave her another personality disorder, which was when she went to work as a prostitute, stripper, and porn model. I gave her a histrionic personality disorder, which is where she is really self-centered and uses her body rather than her emotions to show off and form relationships with other people. For her fifth diagnosis, I gave her a generalized anxiety disorder because she shows an excessive anxiety and worry, which occurs just about the same time period when she's having her major depressive episode. And for a sixth diagnosis, I gave her a psychotic disorder, a brief psychotic disorder, because she sees delusions in times of stress, and it's grossly disorganized and chaotic behavior during this time of stress. And she's, it's not really better explained with her major depressive episode, because she feels this more so whenever she's about to do something stressful, and she feels like she doesn't know where she's going with her life, that she feels like she can't sell out her body anymore because she's already done so much. And finally, for a summary over Jenny Curran's diagnosis, I gave her, for her trauma, it was caused by the environment, and for treatment, I gave her cognitive behavioral therapy, and yes, her recovery is likely. For her self-destructive borderline personality disorder, it was definitely an environmental cause, and I gave her behavioral therapy. And because she's been struggling with this personality disorder for most of her life since her childhood, it has marked for improvement with her relations and her recent birth of her only son. But she will never fully recover for that. She can only improve just a little bit. For her depressive episode, it's both caused by genetic and environmental problems. Her father was extremely depressed because her mother died, and he turned to alcoholism. That's where he got his substance abuse from, and that's when she was physically abused. For treatment, I gave her antidepressants because it's mainly a genetic and kind of environmental factor, and yes, her recovery is likely from her depressive disorder. For her histrionic personality disorder, the etiology is unknown. Still, I couldn't find it in the DMV5, but I looked it up, and there still was unknown for that personality disorder. The treatment I gave her was psychotherapy, and yes, she was likely to recover from that one because she quit her job as a prostitute, porn model, and stripper. And I gave her psychotherapy for treatment. For her generalized anxiety, it's caused by her environment because she doesn't really know where her life is heading. And for treatment, I gave her medication and also cognitive behavioral therapy. Her recovery from her anxiety disorder is not likely because she was recently diagnosed with a disease that doesn't have a cure. For the last diagnosis I gave her was brief psychotic disorder. It was caused by her environment. For treatment, I gave her medication and cognitive behavioral therapy because it helps her. I did mark her for recovery for that one because eventually she's mentioned to me that she's reached out to Forrest, and she will recover her relationship with him. Okay, that's all.